You may be familiar with minimally invasive laser spine surgery procedures, but do you know just how much of an advantage that they can have for you? Joining us now is Dr. James St-Louis, the director of the Spine Division for Physician Partners of America, and he's here to tell us just how this type of procedure works. You know, we have all heard about how much advanced these surgeries have gotten. When we're talking with, about pain with the back, these minimally invasive surgeries are really doing so much good now, aren't they, doctor?
Correct.
So how does it work exactly?
Well, what we do is we make a small incision about a ½ inch, and we put
Half an inch?
Yeah.
I mean, that
a ½ inch for
tiny.
some, and actually some of the procedures are smaller incisions.
Oh.
And the idea is you make that incision so you dilate these tubes down to the spine right here. And then you insert a long camera and you operate off a fairly big TV screen which magnifies the spine about 50 or so times. And so you can accomplish what you need to by operating off this TV set with minimal disruption to the surrounding tissue, which allows a much faster recovery.
The future is here, isn't it?
Yes.
When it comes to this type of surgery. So how long has this been around?
I mean, it's been around. There's like bits and pieces of many things in surgery and medicine. Certain parts were around really from the beginning. But you had to do it through a 6-inch incision. You had to look at it with your naked eye or small glasses. And then in advance, the tubes became, or we inserted the tubes, used a small series of instruments. You incorporate the laser. So I took all of this and put it together in one setting so you could accomplish all that in one setting and one surgery.
I know so many people who had traditional back surgery back in the day, and they had to go back for another one and then another one on top of that. So how has this changed traditional back surgery?
Well, it changed in a big way. If you had to have traditional back surgery, and many people still need that. However, back in the day when you had traditional back surgery, you had, I don't know, 6 or 8 inch incision, and you were, because of the pain and scar tissue, you're required to have more surgery. And to go back in after you've had a surgery is much more difficult than operating on a back that hasn't had surgery.
Sure. So what conditions does this type of laser surgery, the minimally invasive, what kind of conditions does that handle? Does that care for?
You would do herniated disc, bulging disc, anything that actually impinges on the nerve. The most common symptom is stenosis, and stenosis is where your spinal cord or nerve gets pinched, causing significant pain in your back, your leg, your arm, neck.
And does insurance cover this?
Yes, insurance covers that, and our company takes traditional Medicare, and yes.
You know, that's really surprising because it sounds like it's so advanced that perhaps insurance wouldn't, but that's really good news. I know a lot of people will be happy to hear that.
Yes.
All right, you can call now for a no-obligation second opinion or even a first opinion and a free MRI review with Physician Partners of America at 855-25-LASER or log on to their website, PPOAmedical.com. Dr. James St-Louis, thank you so much.
You.
Appreciate it.
You're welcome.
Nice to have you here. Daytime will be right back after this.